Good afternoon, guys. This is Oscar with Gastroenterology Simplified. Today, we're going to talk about a very common symptom or diagnosis in my clinic. That diagnosis is GERD or acid reflux. What is acid reflux? Acid reflux is when the acidity in your stomach goes into your esophagus and you feel it as acid reflux, meaning the acid going into your esophagus. What usually or why acid reflux happens? Usually this is secondary to weakness in the lower esophageal junction. This is where your esophagus meets with the stomach, or at the beginning of your stomach. So where the esophagus and the stomach meet. Usually a weakness there lets the acidity in your stomach travel up to the esophagus. Therefore, you are symptomatic. Usually, if you have acid, or we actually need acidity in our stomach to be able to digest our foods, and we need the acidity. But when the lower esophageal junction is weak, therefore, we have the symptoms of acid reflux. What causes acid reflux? Once again, this is caused by the weakness of the lower esophageal junction, and the acidity in your stomach travels up to your esophagus. Some other factors that may contribute to your symptoms. The factors are gaining weight, tight clothing, smoking, alcoholic drinks, fatty foods, greasy foods, spicy foods, dark chocolate, caffeinated drinks, sodas, carbonated drinks. This usually causes the symptoms to worsen. In addition to experiencing the symptoms of the acidity going into your esophagus, what are some other symptoms? You may experience chest discomfort or substernal chest discomfort. This is usually called or known as atypical chest pain. You may have a bitter taste in your mouth. Even your teeth could become brittle if you have persistent acid reflux. What can you do to avoid acid reflux? Well, this is a very interesting question, because if you avoid the triggers that causes the acid reflux, for example, fatty foods, greasy foods, spicy foods, red sauces, caffeinated drinks, carbonated drinks, alcoholic drinks, smoking, and if you eat smaller meals more often, if you elevate the head of the bed at a 45 degrees, this usually helps your symptoms. In addition, if you lose at least 10% of your current weight, usually this helps tremendously. What other methods or medications could you use to avoid acid reflux or to help the symptoms of acid reflux? Well, you may use over-the-counter medications such as omeprazole, Prilosec, Pepcid, famotidine, lansoprazole. You may get a prescription for Acifex, Protonix, and sometimes Dexilant, which is very, very good. Usually the medications are recommended for about 14 days to 30 days with changes in your lifestyle. And if the symptoms fail to improve, then you should follow with your gastroenterologist. Your gastroenterologist may ask you, have you changed your eating habits? Have you avoided the triggers? Have you changed your diet? And have you tried any medications? If you have said yes to all of them, then consider an upper endoscopy. An upper endoscopy is a scope that goes down your throat, through your esophagus, all the way to your stomach. And the goal is to assess and make sure that you don't have H. pylori, gastritis, gastric ulcers, duodenitis, duodenal ulcers, esophagitis, esophageal ulcers, esophageal strictures, such as inflammation of the esophagus that has narrowed your esophagus. Now, keep in mind that some medications could also cause symptoms or burning in your esophagus, and we call that pill esophagitis. Some medications such as Aleve, ibuprofen, BC-Goody powders, some of the blood pressure medications, and some of the medications used to treat depression, anxiety, could also give you those symptoms. Therefore, after you discuss your symptoms with your doctor, then you can go ahead and try to modify some other medications. All in all, if you are experiencing GERD, or commonly known as acid reflux, try to change your lifestyle. Avoid the triggers. Avoid the smoking, drinking alcohol, Aleve, ibuprofen. Avoid the fatty foods, greasy foods, spicy foods, carbonated drinks, even dark chocolate. Change your lifestyle. In addition to some medications over the counter, which you may take between 14 to 30 days, this usually helps the symptoms. Lastly, if your symptoms fail to improve after trying conservative management, then talk to your gastroenterologist and discuss for the possibility of an upper endoscopy to further assess the etiology or the causes of your symptoms. Usually, with conservative management, you will get some good results, unless you have an infection, an ulcer, and so on. Lastly, if you found this video helpful, please click like, subscribe. That is the best gift you can give me to grow this community. And this will allow me to bring you more information and more videos like this, so I can help you. And as a result, you can feel better much sooner. Thank you for watching, and I'll see you in the next one. Bye.